Hello everyone, it's me, Dr. Lindsay from Morganton Eye Physicians, and today we're going to talk about cataract surgery. So we'll start with a discussion of the relevant anatomy as it pertains to cataract surgery. We'll talk about what is a cataract. We'll talk about surgery and what's involved. We'll talk about some of the different options you have for your surgery, and we'll also talk briefly about the risk potentially of the surgery as well. So jumping right in, we'll start with the outermost part of the eye here, the clear outer layer, and that's the cornea. The cornea is the part you could touch with your finger, or you might put a contact lens on if you wear those. If we go through the cornea, we get to this ring of tissue in here. In this eye it's brown, but it could be blue or green or whatever. That's the ring of tissue that constricts and contracts or expands to regulate the amount of light that's entering your eye. If we go deeper to the iris through the pupil, we arrive at the lens. And that's where most of our discussion relevant to cataract surgery is going to pertain. The reason for that is a cataract is just this lens, but it's gotten cloudy. So the lens starts out clear at birth, but over the course of your life, whether it's due to sun exposure, just time, certain medications, medical conditions, it begins to get increasingly cloudy. And you can imagine if this lens is cloudy, then it's going to impede your vision because you're always looking through the cataract, whether you're wearing glasses or not. So unfortunately, a significant cataract is not a problem that can be fixed by a new glasses prescription. Instead, the goal of cataract surgery is to remove this cloudy lens out of the way. Now that's attained through a small incision. It's placed in the cornea right here. A fancy ultrasound will then be placed through that incision. It will go through the pupil to gain access to the lens. The ultrasound will then be used to groove and sculpt the cataract, break it into a bunch of little pieces, and suction it out of your eye. Now once the cataract is removed, you're left with an empty space here where the old lens used to be. If we were to leave you like that with no lens implant, no lens at all, then you would need really thick glasses to see well. And you may have seen older folks who were walking around wearing those really thick glasses. They could probably see well with them, but they were quite thick. And so nowadays, we have lens implant technology, and a lens implant will be put into the eye so that you don't have to wear those big thick glasses anymore. And that leads us to perhaps the most important part of the discussion, and that is, what are your options for your cataract surgery? There are really three big categories that we need to discuss. The first category is called a monofocal or a distance lens implant or a regular lens implant. And this is one that's already included in the cost of your surgery. It's already factored in by insurance. You do not have to pay anything extra out of pocket to use that lens. And that lens works great for a lot of patients. Where it doesn't work so great is in those patients who have astigmatism. And astigmatism refers to the shape of the cornea that we were looking at earlier. If the cornea is perfectly spherical, meaning the same curvature in all different directions, then you don't have any astigmatism. But like most of us, you probably have some degree of corneal irregularity, meaning the cornea is a little bit steeper or flatter in one direction. And just like if you took the lens of a camera and you physically stretched it, the picture is going to come out distorted. And that's going to affect both your distance vision and your near vision in just the same way. For the patients who have a significant amount of astigmatism, a regular lens implant will not be able to get them the clarity that they might want at distance, and so they'll still need to wear prescription glasses. So for a regular lens implant, if you don't have a lot of astigmatism, distance vision will be really good. Maybe you'll just need reading glasses for up close. For the patients who do have a lot of astigmatism though, they'll probably still be wearing prescription glasses most or all of the time because they'll still need some correction for distance and some near vision correction. That's fine, especially if you don't mind wearing glasses, that's great. We can just put a regular lens implant in there. Once we get both cataracts removed, we'll give you a new prescription for glasses and you should see really well. If, like some patients, you say, well, wait a minute, I'd really rather be able to do most things at a distance, like driving, watching TV without glasses. I don't mind wearing readers, but I don't want to have to wear prescription glasses all the time. And I want to be able to see most things at a distance without having to reach for a pair of glasses. That's when you get into the second type of lens implant, and that is called a toric. A toric lens implant is one that is built in such a way as to mitigate the irregularity of your cornea. It's similar to the way glasses prescriptions are done. The lens is made in such a shape that it will balance out the effect of your cornea. The corneal shape won't change, and so it won't change the fact that you have corneal astigmatism, but it will minimize the effect of that on your vision, so that when you are not wearing any glasses, your distance vision will be way better than it would be if you had done a regular standard monofocal lens. So for most patients who have astigmatism, a toric lens implant will be able to get them out of their distance glasses, their prescription glasses, and they just need readers. If a patient says, well, wait a minute, I really don't even want to have to use the readers. I'd rather be able to do most of everything without wearing glasses of any sort. That's when you get into the third category called multifocals, or premium lens implants. And like a toric, a premium lens implant, it can correct or mitigate the astigmatism, but it also has these little concentric rings built onto the lens itself, and those rings will redirect some of the incoming light to a near point of focus for you. And so what that means is not only are you going to get really good distance vision, but when you look at something at those intermediate ranges like the dashboard or even closer like a cell phone or a book, you're going to see that with much more clarity than you would have with either of the other two lens implants. And so I would say think about what your goals are for your surgery. If you don't mind wearing glasses at all, then go with a regular lens implant and let's just get you a new glasses prescription when we're all done. If you have astigmatism and you don't want to have to wear distance glasses but you don't mind wearing readers, then think about a toric lens implant. If you don't want to wear glasses at all, distance or near, then think about doing a multifocal. It's important to understand though that none of these lenses are going to give you perfect vision. They're just not. You may still need glasses from time to time, no matter which lens implant you pick, no matter whether you have astigmatism or you don't. There are some things that cataract surgery just can't fix, and one of those is the loss of the ability to change focus on things. When you're really young, the lens in your eye can change shape. There's a muscle in there that helps it do that to allow you to change focus. And that ability is lost in your beginning in your 40s, but 50s and 60s especially. Cataract surgery is not going to restore that ability. But we can get around that to some degree with these different types of lens implants. But it is important to be reasonable with expectations and understand that we're not giving you a brand new eye. We're not giving you the eye of a 25-year-old, but we do seek to improve your vision significantly based on what your goals are. So we should also touch on what are the limitations and what are the costs of some of those fancier options. Well, as we mentioned before, a regular lens implant is already included in the cost of surgery. A toric lens implant, there are really no medical downsides or vision downsides to it. It's only going to help you see better if you do have astigmatism, but the cost is really the big limiting factor there. It can run anywhere from $1,500 to $2,000 per eye for that type of correction. For a multifocal lens implant, it's around $3,000 per eye, give or take a couple $100. For a multifocal, it's also important to think about those rings again, because those little rings can introduce some faint halos or potential sources of glare that will be most prominent, most noticeable at nighttime. Most patients say it's not bothersome. Even if they can see them, it's not bothersome. They don't wish they had done another lens. In fact, one of the studies showed that 99% of patients would do the same lens implant again, while only 1% said that the haloing around lights was so bothersome they wish they had done either a toric or a monofocal. So now that you understand all three of those different types of lens implants, I feel you can make a much more informed decision about what are your goals for this surgery and what would you like to do. I do want you to know that no matter which lens implant you select, it does not change the safety of the surgery. The procedure, for all intents and purposes, is exactly the same, no matter which procedure you choose, no matter which lens implant you choose. The risk of the surgery is really very low overall, but there is about a 1% chance of some sort of complication that can affect your vision long term. That could include things like infection in the eye, swelling, inflammation. Maybe the lens implant itself could get shifted or turned throughout the healing process. Most of those things are treatable, but it is important to understand that cataract surgery is an intraocular procedure. We're going into your eye, we're removing something, and we're putting something new in there. And there is risk associated with that. But overall, cataract surgery is an extremely safe procedure. So I appreciate you watching this video. If you have any further questions, feel free to reach out to me. You can call the office. You can leave a comment on this video. You can reach out to, you can even talk to me the day of your surgery. and I'm happy to answer questions at any time. I really do want you to feel like you can play an informed part of this process. And again, remember, there's no one best option. It all depends on what are your goals, what are you seeking with this cataract surgery. So talk to me about it. I appreciate you watching, and I'll check back with you in the next video. Thank you.